one of the world's, this is impressive, largest studies on breast cancer is casting doubt on the effectiveness of mammograms. The American Cancer Society estimates the U.S. will have more than 230,000 new cases of breast cancer this year. Jennifer London is with us now with more details on this study. Jennifer, good to have you here in New York.
It's nice to be here, Tony. And as you mentioned, this is one of the largest studies ever conducted. It followed 90,000 women between the ages of 40 and 59 over the course of 25 years. And the findings are sure to renew the debate and even confusion over the efficacy of mammograms. The Canadian National Breast Screening Study was published today in the British Medical Journal, and it finds that death rates from breast cancer were about the same for women who got mammograms and for those who did not. Here's the breakdown. When you look at the numbers of women who received mammograms and were diagnosed with cancer, 500 died, compared to those who did not have the screening and were still diagnosed with cancer through manual exams. 505 died. So again, the numbers are nearly the same in terms of death rate, according to the study. Additionally, it found that women who got mammograms were more likely to be diagnosed with breast cancer, which on the surface sounds like a good thing, catch the disease early. But according to researchers, that can lead to the overdiagnosis of breast cancer. Researchers conducting the study concluded that 22% of cancers discovered during the screening process were overdiagnosed. And another way to think of it, that means 1 out of 424 women who were screened received treatment that was deemed unnecessary. Based on the study's finding, the lead author, Dr. Anthony Miller, says women shouldn't get mammograms as part of their annual preventative care.
There is no benefit in an era when where we have modern treatment for breast cancer, adjuvant chemotherapy, hormone therapy, to use mammography.
Dr. Miller says the primary issue with mammograms, as he sees it, the machines are unable to determine whether the cancer is slow growing and may not be harmful if left untreated, or whether it's fast growing and needs immediate medical treatment like surgery. He believes mammograms should only be used as a tool after breast cancer has been detected. The mammogram debate has been going on for a number of years after a government panel recommended that most women under 50 could skip the screening. Still, here in the U.S., according to the CDC, 67% of women 40 or older have had a mammogram in the last 2 years. And earlier today, I spoke with the American Cancer Society, and they continue to recommend women age 40 or older have mammograms every year and should continue to do so as long as they remain in good health. Additionally, they review their guidelines about every 5 years and are currently in the review process. Tony, they say they will take this study, among others, into account, and they may issue updated guidelines later this year.
Boy, there is a lot to chew on here. All right, Jennifer, good to see you. Thank you. Thanks. And let's talk to Dr. Devi Nampiaparampil. She is with us now to talk about the study and why doctors are so split on mammograms. Dr. Devi, it's good to see you. What is your first of all? Yeah, it's a pleasure. What is your reaction to this report?
Well, I think it needs to be looked at in context. So the first thing to remember is that mammograms are not a perfect test. Now, a perfect test would tell a person who has cancer that they have cancer. And it would also tell someone who doesn't have cancer that they don't have it. So, you know, mammograms have problems in both areas, but they might be the best thing that we have. So, for example, if someone has cancer, sometimes mammograms miss them. But that's why we tell people to do self-breast exams also.
Yeah.
Yeah, in other people, sometimes, you know, you have a mammogram and it'll come up with maybe a positive result, but that person might not have cancer. So you actually can get unnecessary tests. But the fact of the matter is that doesn't mean that mammograms are not helpful at all or not useful in certain people. One of the other things to think about in this study, just along the same lines of what Jennifer London was saying, first of all, they're looking at death rates, but that's not the only measure for cancer. Now, if someone gets diagnosed with breast cancer and dies within 3 months, that's very different than someone who gets diagnosed with cancer and dies about 25 years later. But both of those people would have died from the breast cancer. So you have to consider some of these other measures as well.
So wait a minute, doctor. When and under what circumstances do you believe now that women should have mammograms?
Well, the American Cancer Society and the American College of Obstetrics and Gynecology, they have the same recommendations. So I go with them, but they say that women should have mammograms every year after age 40. Now, I also think people should do a lot of regular self-breast exams. I mean, the reason is that actually if you're a younger person, you might get a more aggressive cancer if you get diagnosed with cancer. So every year, getting a mammogram every year may not even be enough. So you really want to be on top of things, because if you get something at a young age, that means that your immune system wasn't able to fight it, that it might be more aggressive. Whereas if you get diagnosed at age 80, for example, it probably isn't as aggressive of a cancer. So it's really a very complicated issue.
All right, Dr. Devi, last question for you. Why is the medical community so split on mammograms?
I think it's the same confusion, the fact that mammograms aren't a perfect test and we don't have a perfect treatment either. So depending on which side you lie on, if you'd rather have catch everybody with cancer and treat them no matter what, that's one extreme. If you're at the other end and say, well, I really want to reduce the harms to people who don't have cancer, I don't want people who are healthy to have all these unnecessary tests and treatments, then you might say, well, let's reduce the number of mammograms. So it really depends what your values are based on.
Dr. Devi Nampiaparampil. Hot dog. I got it again. Good to see you. What a pleasure.
Good to
Thank you
see
for
you
your
too.
time. A real pleasure.